in and out. Amazing. So you've been scheduled in for a lobotomy with me today. Don't worry, this is a simple routine procedure. Great. So I'm going to start by asking you a series of questions. Standard. Okay, just relax for me. Relax, 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 relax for me, darling. Perfect. I'm just going to be taking some notes, okay? Great. First, when was the last time your mind felt quiet? Okay. A rough estimate is fine. Great. Just for your consent and just for the forms and the technicalities, the legal stuff, do you trust me and give me permission with your brain today? Great. If I could remove one reoccurring thought, which one would that be? Great. And what keeps you up at night? Your imagination or your anxiety? Okay. Would you describe your mind more as a forest or an ocean? Okay. It just helps tackle the way we carry out the procedure. Okay, great. And with our lobotomy today, are we focusing more solely on healing or deletion? So we can heal some memories, or we can focus on just deleting them completely. Okay. Great. And finally, do you want slower thoughts or fewer thoughts? Would you like slower or fewer? Yeah. Okay, amazing. I think we have everything we need to start. Okay. So the way we like to start these lobotomies is I'm actually going to be giving you a quick scalp scratch and head massage. And what this is going to do is it's going to just release any built up tension right here in your cranium, and it's going to just loosen up some thoughts and some memories that we're aiming to remove, okay? I'm just going to get right in there to stimulate the cranial circulation. Please let me know if the massage and the scalp scratching is too rough, okay? Really need to get in there and loosen those memories. Just gonna scratch right here. Scratch. Here, scratch, okay, right on the top of your head. think we've loosened up your memories enough. So next we're going to sterilize everything. I'm going to pop on some latex gloves. You're not allergic, are you? Okay, amazing. And we're just going to sterilize the head and move forwards with the procedure. Okay, wonderful. We're now going to start with the sterilization process. So what I'm going to do is I have this spray, and this is just going to kill any bacteria that may be right here on your temples, okay? Quickly before we begin, I'm just going to feel around your head. Tell me if you feel any pressure, any pain, soreness, anything like that. I'm going to check for any swelling or any lumps, anything that would indicate it's unsafe to do the procedure today. Does this hurt? Okay, and here. And what about at the top? No? Okay, what if I just press? Okay, and here, press. And here, if I press, okay. Moving. Good, okay. Just gonna go ahead and sterilize your temples. So it might just feel a little bit damp. And here. And spray it. Good, okay. Good. We're just going to wipe that in now. I'm just going to wipe. Okay, so your file mentioned that you tend to get quite anxious. We do have some anti-anxiety medication here for you that we're just going to administer just so this is a nice and relaxing experience for you. Nothing that's going to stress you out too much, okay? Okay, just open wide. Another one. Another. And one more. Good, that should be enough, and that should help to calm down your nerves, okay? Just relax with me, okay? Just relax, good. I'm now going to administer some numbing injections, okay? I'm going to go right here on the side of your forehead and administer one here. Administer an injection right there, the side of your forehead. Good, I'm going to do one right in the center of your forehead, right between your eyebrows. Good. Great, and we'll administer one right here on the side of your head and on the other side as well. And finally one in the back, okay? And we need to just do a couple kind of in the cheekbone, because sometimes as a side effect when we're doing the lobotomy we're scrambling the brain, it can paralyze other parts of your face. So we're just going to add here. Good, perfect. Okay, are you feeling safe? Are you feeling comfortable? Like warning, we're going to be using this laser to open up your skull and gain access into your brain. Okay. Around the whole head. Okay, great. Now that we've made an opening into the brain, we're just going to go ahead and crack it open, okay? So I have this invisible ice pick right here. I'm just going to ice pick it into your skull, okay? Don't worry, you might feel a slight pressure, but no pain. Good. Grab another one, pop it right there. Good. Put one right in the center. There. Amazing. One there. One here. And I think you need another ice pick right there to help open that up. Okay, I might have to grab the hammer. Don't worry, it's not as scary as you might think, or as it looks. Just bear with, I'm just going to use this to hammer in all of the little ice picks into your skull, okay? Let me see. Okay. That's looking really good. Okay. Now we'll just crack it open. We're going to use the back of this and okay, amazing. We have access into your lovely brain. Okay, commencing with the scramble process. I'm just going to stick these two prongs into your brain and scramble them, okay? So just how is that feeling? Good, okay. Back into the brain, back here. collect some samples as well, if that's okay. I mean, it's not part of the procedure, I just wanted to conduct some studies. You did sign a consent form before you entered, right? I'm sure you did. I'm just going to collect a little sample here of your brain. Collect this little sample. Thank you. Collect one here. I'm just gonna get in and collect this little sample. Okay. And there. There. Good. Getting a lobotomy anyways, it doesn't matter if I take all these samples. Don't worry. Don't worry. Don't worry. I'm just going to collect that and grab this. And at the back there was something weird. I want to grab a little sample of that. I'm just going to scrape it off your brain to collect and run through the labs, okay? Good. Okay. Next, we're gonna go ahead and do the removal process of the lobotomy. Remove anything you'd requested. Okay, and we'll just remove those memories. Okay, I'm just going to pluck and just get in there and pluck and pluck and pluck. And I have to have a quick search, okay, through the brain, so pluck. Did you want me to remove that memory? You should. I'll remove it for you anyways, okay? Pluck. Clear the police. It's fine, this is a very legal practice. Pluck. Just gonna go in here and pluck. Feel around the brain, okay, just to help lobotomize it a little bit more. Just do a little bit of squeezing. On the back. Good, okay. I think that's good. I'm just gonna go ahead and reseal your skull. Marvelous. Next, just to deal with the recovery, we're going to inject some stem cells into your scalp, and this is going to help regenerate skin, bone, everything on your scalp to get a nice, quick and efficient recovery, okay? So I'm just going to inject some stem cells into your scalp like this, just all over your scalp, the back, the front. Okay, some patients do experience just a little bit of hair loss just from the trauma of the surgery, but we're going to help stimulate hair growth as well. Just give me a second. Just keep injecting these stem cells into your scalp first. Okay, amazing. Almost done. Good. I'm going to be using this on your scalp to gently massage, and what it's going to do is just stimulate the hair growth, okay, and stimulate those stem cells that we just injected into your scalp. Okay, so just well, that is the end of your lobotomy today. If you have any side effects or any memory loss problems or anything that wasn't discussed prior, you did sign a waiver, so we are not legally liable or responsible for anything else. Okay, please don't forget to leave 5 stars for us. And remember, if you refer a friend for a lobotomy, you do get a discount of 3% off your next procedure. Okay, that's all. Thank you. Hi. Welcome to your eye exam. I am Dr. Angelic. Nice to meet you. I don't think we've met before. And when was your last eye exam? Okay. So you are a little bit overdue. You are just a little bit overdue. That's fine. Nothing to worry about. Have you been squinting or anything recently? Finding it hard to see? Anything looking a little bit more blurry? Okay, we'll investigate that. Okay, off the bat, you've probably seen this chart a million times. I'm going to ask you to read the lines, okay? Could you please read the second line for me? Good. Could you please read this line for me, the 4th line? Good. Excellent. Amazing. Perfect. Okay, could you please read this line right here, the 6th line for me? Yep. Good. Perfect. Amazing. Could you read anything here? Could you read this line for me? Yep. Perfect. Next, I'll be testing to see if one eye is slightly stronger or slightly weaker than the other. I'll be using this little device right here and covering one eye at a time, and you're going to identify some things I ask you, okay? Great. So first, can you tell me how many fingers I'm holding up? I'm gonna cover this eye right here. How many fingers? Good. And now? Excellent. And now? Good. Amazing. And could you tell me what shape I'm tracing? A triangle. Good. Okay, we're gonna do the other eye. Other eye. You're doing really well. I'm just gonna pop this right here over this eye. How many fingers can you see? Good. And now? Good. And now? And now? And now? Perfect. Okay, and what shape am I tracing? Again. One more time. A circle. Okay, perfect. Would you say that maybe you struggle with your vision in one eye over the other, or have you noticed no difference? Okay, good. Good to note. I'm just going to be testing the pressure in your eyes, okay? In your eyeballs specifically. I'm going to just ask you to open this eye nice and wide for me, and you're going to feel a little bit of air, okay? Nothing to be scared of, no pain, I promise, okay? Just going to test the pressure in your eye. Okay, you can blink. You can blink, blink, blink. Good. And let's do the other eye now, okay? Just open that eye up for me. And good. And again, just blink, blink, blink. Good. Next. I'm just going to be having a little look in both of your eyes with a torch. It's going to be a little bit bright. I'm just going to make sure your eyes look nice and healthy, okay? Perfect. Okay, flash warning. Can you just look right here at my finger? Don't look anywhere else. Just look right at my finger, right here. Okay, and we're gonna look at the other eye now. Just look at my finger. Just look at my finger. Okay, good. I'm gonna ask you to look up for me. Can you just look up for me? Up. Just look up. Perfect. Okay, can you just look straight at my nose? Look straight. Amazing. Could I ask you to look to the side for me? Just look down there. Just look to the side. Just look to the side. Good. Could you look the other way now? Look to the other side for me. Just look to the other side. Good. And now could you just look down? Keep looking down for me. Just like that. Okay, good. Can you look straight at me again? Good. Can you look here at my finger? Perfect. Can you look here at these fingers? Good. Okay, your eyes look very healthy actually. Okay, this is my fixation stick. If you just go ahead and look at the red dot for me. I'm just gonna test something. Just look at the red dot. The red dot. Can you now just look at the green dot? Look at the green dot for me. Look at the green dot. Okay, good. If I turn the stick around, can you just please identify one of the animals that you can see? And is that the animal you can see the clearest? And what about from this distance? Can you identify any animals for me? And you should see a green circle and a red one. Which one is more clear? And if we come a little bit closer, could you identify any other animals? And which animal is the most blurry? And which animal is the most clear? Okay. I'm also going to go ahead and pop these special glasses on you, okay? Just like... I'm just going to ask you to identify the colours for me. Okay, what colour is this one right here? Good. This one? Good. Can you tell me what colour this one is? What colour is this? What colour is this? And what colour is this? Okay, good. Okay, also since you have those lenses on, I'm going to ask you if you can identify the first number you can see. First number you can see. And now? Good. The first number you can see. And now? And now? Good. It's the first number you can see now. First number you can see now. If you don't mind, I'm also just going to take a picture of the back of your eye. Okay, just make sure everything looks nice and healthy and, put that on our system. So, I'm just gonna ask you to look right at my nose for me, and it's gonna be a bright light, okay? And good. Okay, look at my nose again. Good. from further back. Look straight ahead. Good. One more time. Good. I'm just gonna have a quick look in your eye here. Good. I'm also just going to be testing the pressure in your eyeball. If I just open up this eyeball just like that, and it's not gonna hurt, I promise. Good. Blink. 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 I'm gonna open up this eyelid, same thing. Good. And blink. 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 Okay, next, I'm gonna go ahead and test your peripheral vision, which is just everything you can see just right on the edges of your eyesight. Okay, I have 2 fingers here. Tell me when they both leave your field of vision. Okay, you can just say it now. Okay, so good, 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 good. Good, we're gonna go a little bit slower, okay? Yep. Perfect. Amazing. Yep. Good. And one more. Good. And a little bit faster as well. Yep. 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 And good, perfect. Good. I'm going to be moving either this hand or this hand. We have left and right. Tell me if my left hand is moving or my right hand. Ready? Yep. Good. Good. Perfect. Same thing, we're going to do it again, but up and down, okay? Up and down, okay? Tell me which one's moving. Good. Correct. Amazing, amazing, amazing. Amazing, amazing, amazing. Amazing, 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 amazing. One more test. This is corner 1, corner 2, corner 3, and 4, okay? Please tell me. Please tell me which corner I am pointing to, okay? Good. Perfect. Yep. 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 Amazing. I'm just gonna take these lenses off you now. Thank you. They're really good. You can adjust them like this. You can adjust them. And at the top here as well. Okay, I'm just going to test your prescription. So I'm gonna do this lens right here. This is lens number 2. Could you read the 3rd line for me? Good, okay. We're going to now do lens 1, which is this one right here. Good. And could you please read line 5 for me? Perfect. Okay, let's move down to lens 3. Could you read line 6 for me? Good. And could you tell me if there's a difference, if they look more clear with lens 1 or 2, okay? This is lens 1 and lens 2. Lens 1 and lens 2. 1 and 2. Or does lens 3 look more clear? Or 4? 3, 4, or 1, or 2. Lens 1, lens 2, lens 1, lens 2, lens 3, and lens 4. My fingers, how many fingers can you see in lens 1? And how many fingers in lens 2? 1, 2, 1, 2. Good. Okay, let's go the other way. This is the first lens and the second lens. First lens, second lens, first lens, second lens. Which one looks more clear? Interesting. Okay. Can you tell me if my hands are getting closer to you or further away? No? Good, now? And now? Again? Okay, interesting. Cards here. Can you tell me what this is? Okay, what's this? Good, garlic. What's this? A cucumber. Can you name me anything on this card, please? Good. Can you name me anything on this card, please? Good. Name me something different on this card. Good. Can you name me this? What do you think that is? Banana. What do you think this is? A crown. What do you think this is right here? A horse. And what do you think this is? A troll. Good. Very good. I do think you might need some glasses. I do think you need some glasses. Now we have different options for you. You can either go for a more round style like this. Should we try these on? Pop these on your face. Let's see how these frames look. I think it really complements your jawline. Or you can try something like mine, where it's a lot more square. Do you see the difference? Rounded and square or rectangular. Let's try these ones as well. Just pop these on. How do you feel with these? They look good as well. Let's try the round ones again. And these ones, sorry. Which ones would you prefer? The round ones? Okay. We can give you the round ones. We can give you the round ones. Give you the round ones. I will just type up your prescription. And we'll send that your way, and you can come in for collection of your glasses, because you will need glasses, unfortunately, next week. Does that work? Okay, amazing. Perfect. See you next week. Hello, and welcome to your dentist appointment. Yes, I am Dr. Angelic, and I will be your dentist today. Great. Have you been to this dental practice before? You haven't? You're new? Okay. That's fine. We're just going to do a routine checkup, okay? And if you need any sort of treatments or procedures done, we'll go ahead with that. Is that okay? Amazing. Okay. Just a couple of details, okay? Okay, firstly, I'm going to take down a couple of details. Okay. Can I please get your first name? Okay, great. Lovely to meet you, Bob. And how old are you? Really? You look really good. You look really young. Okay. And we're going to start by just marking your teeth with any cavities or anything that we see, okay? So I'm going to ask you to actually open up, and I'm just going to quickly inspect your mouth, see off the bat what we can see, if maybe you have any cavities, if you've had any previous fillings, anything like that. Is that clear? Okay, great. So just sit back, relax. I see that you actually have your retainers still in. I'm just going to go ahead and remove those. Okay, I'm just going to take those out. And these as well. Perfect. Okay, just gonna have a quick look. I'm gonna tap each tooth to see if I can feel any softness or anything concerning. Off the bat, I do see a couple of cavities, but it's pretty normal. Don't worry, we can definitely treat that. Okay, does this hurt? Does it hurt? Okay, does this hurt? This. What about here? And okay, I'm just up. It's okay. Do you brush 3 times a day? You just brush twice a day. That's also normal, don't worry. 3 times actually is excessive, so don't worry about that. Okay, good. Oh, I see a little bit of dried banana here. Did you have banana recently or banana crisps? Okay, interesting. Okay, so based on my inspection, I did find a cavity right here and one right here, but it's normal. We are going to also tackle a cavity right here as well. But you have a couple of cavities right here on your molars, which might be a little bit more painful, but it's gonna be fine. We're gonna give you some injections, okay? So what we're gonna do is a routine checkup. So examine, clean, extract if we need to, don't worry, and then give you any set of braces as well. Okay, perfect. So I know I did do a surface level inspection, but I am also just going to go ahead and take a couple of x-rays for our files. Is that okay? Perfect. Okay. Okay, can you just open your mouth nice and wide for me? Great, it's going to be a little light. Okay, I'm going to take this x-ray. 3, 2, 1. Good. And another one. 3, 2, 1. Good. One more. 3, 2, 1. Good. And just one more right there. 3, 2, 1. Okay, perfect. I think we have your x-rays. One second. Okay, your x-rays have come back and they are as expected, okay? So we do have just a couple of cavities. We're gonna go ahead and drill those out and give you some fillings, okay? Give you some fillings. So we have this is 1, 2, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And we have one little cavity right here, one little cavity there, and one here. So just 3, okay? Okay. So to start off, I am gonna go ahead and inject your mouth. Okay, are you okay with injections? You are. Okay, that's good. So I'm just going to inject your mouth, and it's just administering anesthetic, a local anesthetic to numb your mouth. Okay. Okay. And you will require quite a few injections. Okay, I'm sorry. Okay, we just want to make sure you don't feel anything. So keep your mouth nice and wide. You're gonna do injection right there. I'm gonna do one there. One right. Good. Sorry. I think we have to give you quite a few. You're gonna do one right in your gum here. Okay, can you feel this? You can still feel. Okay, we have to give you a couple more. Okay, how's that? Can you feel this? A little bit. Okay, I'm just gonna do one injection right here. Okay, good. I got teeth a little bit more. Just gonna look right here. Look right here in the bottom set of teeth. Okay, looking at this tooth, looking at this one. Okay, just gonna okay, with this one we definitely need to go ahead and drill that tooth and give you a filling for that one. This one, maybe we can do something else. Does that need that does need a filling, okay? Just gonna look up here, just keep your mouth nice and wide and open for me as I'm just looking, okay? I'm just checking everything. I don't want to give you a filling in the wrong tooth, okay? And I'm just checking to see if perhaps you need like a root canal or something. Hopefully not. Hopefully it won't come to anything like that. But so far it's looking pretty good. Just gonna look good, okay? You don't need a root canal, but you do need a couple of fillings, okay? Okay, stay very still. I'm just gonna drill into the teeth that require fillings, okay? So right here. or the white filling, the gold or the white? Which one would you like? White? Okay, we can give you a nice white fillings. So I'll just open this up. Okay, let's grab this. Okay, I'm just gonna give you a nice filling here. See. Good. Okay, you're doing really well. So next we're just going to cleanse your teeth today before you leave. So, do you floss? How often do you floss? Okay. So please try to floss after you brush your teeth, okay? At least once a day, but preferably twice, okay? Okay, I'm just going to just get in between all your teeth there. Just flossing to get all the food out of your teeth. Okay, like that. There we go. Okay, just get in between the teeth right at the back. I know, it's quite hard to get the teeth right at the back, right? Just do your best, or you can get a water flosser. They're pretty good. They're pretty helpful. Okay, just getting that. Sorry about the loud traffic in the back. It's done. Just getting out all the food from in between your teeth. Okay, good. Okay, I think that's all the floss done. Let's have a look. Let's have a little look at your teeth. Little flashlight warning. Okay, good. It's looking very good, very clean, and the fillings have set really nice. Okay, I am gonna go ahead and brush your teeth. Okay, we have this special whitening toothpaste. Special whitening toothpaste, and really good toothbrush as well. It's an electric toothbrush. What toothbrush do you have at home? Okay. A manual toothbrush will do just as well, but I would highly recommend a electric toothbrush, and just really focus on each tooth, okay? So I'm just gonna go ahead and put the whitening toothpaste on the toothbrush, okay? Just going to okay, let's turn the electric toothbrush on. Don't worry, this is disposable. We don't use this on every single client, I promise. So we'll just turn this on. Just brush your teeth. Okay, just open really wide. I'm just gonna get in the back, okay? Go just swish it around in your mouth for me. And just spit it back out into the cup. Good, perfect. I also noticed that since you had a couple of fillings that we had to tackle, or give you a couple of fillings, sorry, from your cavities, do you consume a lot of sugar? Okay, well we actually sell these. These are calcium vitamin D tablets, and it's just gonna help strengthen your teeth, okay? So let me just give you one now. Just going to open wide. There you go. And you can buy these at the reception desk. They only cost $49.99. Yeah, very cheap, very cheap, clearly. Okay. I think we're almost done. I just want to quickly measure something. I just want to measure your teeth here. Okay, perfect. Okay. Yeah, but you do need braces, so is it okay if we pop some braces on your teeth? It's a really quick procedure. I'm just gonna go ahead and just clip these on like that. Super simple. And the other, just gonna pop those braces on your teeth. Just gonna drill them in, okay? Okay, so let's mark off the treatments we did today. So we did do the examinations, so I'll just mark that. We did do a clean and an extraction. We didn't actually do an extraction, but we did give you retainers and braces. We gave you, you're going to buy the calcium supplement. Okay, good. And we did brush your teeth, but you need to do this as well. So altogether, your bill for today will be $5,000, okay? And we'll be paying today with cash or card. Okay, good. Well, because you're using card, there's actually going to be an additional card fee, okay, machine fee, which will be an extra $200, okay? So altogether it will be $5,200, okay? It's gonna be $5,200. Hi, welcome to your doctor's appointment. I am the ASMR doctor. My name is Angelica. Nice to meet you. Yes, so how have you been recently? I heard you haven't been feeling well. Okay, no worries. We're just gonna go ahead and inspect you to make sure everything is okay. Have you had a cranial nerve exam before? Okay, we'll just be going through all the senses and testing things, okay? Okay, to start off, I'm just gonna be listening to your heart rate, okay? Just stay still for me and take a deep breath, okay? Good. Okay, can you take another deep breath for me? And okay, that sounds good. I'm just gonna quickly inspect the inside of your mouth. If you could just open up, I'm gonna place this on your tongue and have a quick look inside your mouth. I'm just gonna look, see if there's anything suspicious. I'm just gonna look at the back of your throat to see if there's any redness, irritation, swelling. Okay, that's fine. Can I look inside your ear? Okay, great, thank you. Okay, I'm just gonna look inside this ear. Okay, I'm just gonna look inside the other ear. Have you had any earaches or anything recently? Any tinnitus, ringing? No? Have you been having any hallucinations, maybe auditory hallucinations of maybe cat meowing or anything? No? Okay, good. Just gonna quickly check your eye receptors, make sure everything's fine. Can you just follow my finger? Good, look at my finger, don't look anywhere else. I'm just seeing how your eyes react to light. Look at my finger. Can you follow the light for me? Follow the light, follow the light. Okay, that looks good. How many fingers am I holding up? Now, and now. Okay, I'm just gonna be testing your nerves. Okay, I'm just gonna do a little pinch. Could you feel that? Okay, can you feel that? A pinch. Okay, good. Can you just push against my hands as hard as you can for me? Ready? 3, 2, 1, push. Good, okay. And I'm gonna pull your arms forwards towards me, okay? Just checking that. Okay, good. Can you just show me your hands? I'm just gonna inspect them. Make sure everything looks normal. Okay, in this hand. Okay. Good. I'm just gonna feel your scalp. Any tenderness or pain? Okay, I'm gonna just feel around your head. Okay, I'm gonna just feel your face. Any lumps, bumps, swelling. Okay, that's all good. Next, really simply, I'm just gonna test your temperature. So if you just open your mouth, I'm just gonna take your... Oh dear, okay, you do actually have a slight temperature. Don't worry, we're gonna fix that. Do you have a headache? Okay, let me see. You are quite warm, and I see a little bit of sweat. Okay, I'm gonna give you this little injection. It should help you feel better and relieve the symptoms. It should help you relieve the symptoms almost instantaneously, okay? So I'm just gonna give you an injection here and here. There you go. Let's see. I'm just gonna do a quick scan, okay, of your head. Stay still. Okay, and I'm gonna go all around your head, okay, with the scan. Just scanning your brain. Okay, good. From the top to the bottom, scanning. Good. I'm just gonna scan shoulder to shoulder. These scans are gonna flag up. Flag. These scans are gonna flag up anything cause concern. Okay. Anything of cause for concern. Okay, good. Okay, can you extend your arm towards me? And the other arm. Great. I'm gonna take some measurements. Okay, I'm just gonna measure. 9. Okay. Just gonna measure here. Okay. Gonna measure the length of your arm. Okay. And I'm gonna measure the length of the other arm. Good. Can you stand or like sit up really tall and straight for me? I'm just gonna measure from the center of your back to your head. Okay, quite tall, nice. Okay, next we're going to be doing a very short cranial nerve exam sort of thing for you, okay? Sort of thing for you. But before that, I'm just gonna take a couple more vitals, okay? So we're just gonna take your blood pressure, okay? Have you had your blood pressure taken before? Okay, just put your arm through here for me, darling. Good, I'll just secure that around your arm. This is the little monitor, and I will just be going ahead and squeezing this. It's going to tighten around your arm, okay? I'm going to take your blood pressure. Okay, it's looking good so far. It's looking good so far. Okay, that looks normal. Let's go ahead and remove that from your arm. Amazing. Onwards with the examination. I'm just going to be testing the nerves, okay, on your body. So I have this little pinpoint thing here. It's going to tap different areas of your hand. Tell me if you can feel it, okay? So in your hand, I'm going to touch your pinky. Can you feel that? Okay, ring finger, middle finger, pointer finger, and thumb. Good, and I'm just going to go in the center of your palm. Can you feel that? Excellent. Okay, other hand, pinky, ring, middle, pointer finger, thumb, and the center of your hand. Can you flip your hands over? Can you feel this? Can you feel that? Can you feel that? Good. Okay, other hand. Can you feel this? Can you feel that? Can you feel that? Good. And now I'm gonna roll. Okay, on your hand. Can you feel this? Okay, good. And the other hand. Can you feel this? Okay, good. Next up. I'm just gonna use a hand stimulation kit. Again, just testing the nerves in your hand and arms. Okay, so just give me your hand. I'm just gonna see your hand should just get slightly pink. Okay, it's just gonna give us a good indication of the blood flow and circulation in your hands. Okay, good. And the other hand. Okay, I can see that's getting a little bit pink. That's perfect. That's exactly what we want to see. Okay, I'm just stimulating the blood flow on this hand as well. Perfect. Okay, let me see both hands. Okay, good. Okay, so next I'll be testing the nerves on your face. So I have two different tools here. I have this nice soft tool and the sharp tool. The nice soft and the sharp. So I'm going to ask you to close your eyes. Close your eyes for me, because I'm just going to ask you to focus very closely on what you can feel, not what you can see, okay? So just close your eyes. Okay, are you ready? So does this feel soft or sharp? Soft or sharp? Soft, very good. And this one? Soft or sharp? Sharp, good. Okay, again, soft or sharp? Soft, very good. And now? Sharp, excellent. And now? Sharp again, and one more time. Soft or sharp? Soft, very good. Okay, so next for the cranial nerve exam, we'll be testing the sight. I have a little pack of crayons here, and you're going to tell me what colour I'm pointing to, okay? So right here at the top, you should see a variety of different crayon colours. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 24. Okay, you ready? What colour is this one right here? Pink, good. And this one? Green. That's a little hair. Okay, and this one right here? Blue, this one? Purple. White, this one? Orange, very good, this one? Yellow, and we'll do one more. Let's do this. What colour is this one right here? Brown, good. Perfect. We're just going to try something a little bit different, a little bit different. These are my nails, and they have either spots or stripes. Okay? You're going to tell me if the nail I show you has spots or stripes, okay? Okay, this one. Good. Spots. Okay, what about this one? This one right here. Good, stripes. Good, could you actually just read out the pattern to me? This one, stripes. This one, spots. This one, stripes. Spots. Good, this hand. Spots. This one, spots. This one. Good, stripes. This one, spots. And this one, stripes. Good. So I have some different essential oils here, and we're going to be testing your sense of smell. Your sense of smell. Okay, so the first one. And try to get these as accurately as you can, okay? If they seem very specific, that's because they might be, okay? So, I'm just going to ask you to take a nice sniff of this one. Good, okay. What do you think that one is? What do you think? What do you think? Smell it, smell it, smell it. What do you think that one is? That's so good. Blue cheese. That's correct, that's correct, that's correct. Blue cheese. Do you like blue cheese? Do you like blue cheese? I do. I personally do. Just a little bit. Just a little bit. Okay. Next one. Let's grab the next essential oil. Okay. What do you think that one smells like? I know. Smell this one. Smell it. What do you think? Smell it. Smell. What do you think that one is? What do you think that is? Insect repellent. Very good. Very good. It does smell like that. That's really excellent. Okay. Next. This one. Okay. What do you think this one smells like? Smell it. Smell. What do you think? What do you think this one smells like? What do you think that smells like? Manure. Very good. Very good. Yes, manure. Very good. Yes. Good. Okay, so your sense of smell is not impaired, which is very good. Good thing. Okay, let's actually test your sense of taste. Okay, your sense of taste. I have this spoon here, and I'm gonna load at different tastes. Okay, you're gonna tell me what you can taste. So I'm just gonna start with this one, and what does that taste like? Yeah, what do you think? Lemon. Very good. Excellent. Very good. Okay, here's the next one. Okay, open your mouth and just taste this with me. Okay, what do you think that one tastes like? Yeah, a lot of people don't like this one actually. What do you think it is? What do you think it is? Chocolate. Very good. It's chocolate. Okay, good. Let's do another one. Okay, open wide and okay, what do you think that is? What do you think? Licorice. Good. And final one, we'll do one final one. This one's okay. Quite a strong one. Okay, what do you think that is? Coffee. Very good. Coffee. Finally. I'm going to be testing your sense of sound. I'm going to be making some sounds either from the left or the right, and I need you to identify which sound is coming from where, okay? So first we're going to start with a little bit of scratching, and please tell me if you think the sound is coming more from the left or the right, okay? Good. And what about now? And now. Good. And now. Perfect. Can you tell me if the sound is getting louder or quieter? Good, and now. Good, and now. Good, and now. Good, perfect. We're gonna do some tapping. Same thing. Now. Good, now. Perfect, now. And now. And now. Perfect. Well, it seems that your sense of sound is also working, so that is exactly this video helped you relax, and hopefully get tingles. If you enjoyed the video, please don't forget to leave a little thumbs up, a like. I'd really appreciate it. It really helps. And if you would like to see more content from me, feel free to subscribe. This video was quite fun because I feel like I haven't done a medical ASMR video in a while, and so I wanted to do a little quick fire of multiple medical role plays, one after the other, pretty quick. And yeah, I think maybe it's my attention span, but I love videos like that rather than just like one big medical video. But I also do enjoy full length roleplay videos too. Please let me know which roleplay you like the best. You like the best. It's very interesting to me. Anyways, guys, I love you all so much. I hope you're having the most wonderful night, evening, day, week, month. And yeah, I have some really fun video ideas coming up, and I feel like I always say that, but I'm just always so excited to share these really tingly ideas to help you fall asleep. So if you don't want to miss it, press the little notification bell. And yeah,